Hello, I'm Dave Zanoni. I'm a certified canine and feline nutritionist, and I own an independent pet nutrition store in Hartsville, South Carolina. Today, I want to talk about something that worries a lot of pet parents: kidney disease. It is one of the most common chronic conditions we see in dogs and especially in cats. But here's something that many people do not realize. Kidney disease usually develops very slowly, often over many years, and most of the time there's no obvious symptoms early on. In fact, veterinary research shows that clinical signs usually appear only after about 65 to 75% of the kidney function is already gone. That is why understanding the possible causes really matters. Today, I want to walk through this from a nutrition perspective. Not fear, not blame, just science. First, let's talk about what kidneys actually do. The kidneys are filtration organs. Every minute of the day, they filter the blood. Inside the kidneys, there are millions of tiny filtration units, and these are called nephrons. Their job is simple but extremely important. They remove waste products from the bloodstream. They regulate fluid balance. They help control minerals like sodium and potassium. They help regulate blood pressure. They activate vitamin D, and they help support red blood cell production. In simple terms, the kidneys act like a body's filtration and recycling system. But kidney tissues has a limitation. When a large number of kidney cells are damaged, they do not regenerate well. This is why chronic kidney disease is usually progressive. Now let's talk about what can stress the kidneys over time. In most cases, there's not just one cause. Kidney disease usually develops from multiple small stresses that accumulate over many years. One of the factors researchers often discuss is hydration. Dogs and cats evolved eating prey that contained about 65 to 75% moisture. Dry kibble typically contains only about 6 to 10% moisture. Now, dogs usually compensate fairly well by drinking water. Cats are different. Cats evolved as desert hunters. Their thirst drive is naturally low. Many cats simply do not drink enough water to fully make up from the lack of moisture in their dry food. This can lead to more concentrated urine, and this can increase the workload on the kidneys over time. Now, this does not mean that the dry food automatically causes kidney disease, but hydration does play a role in long-term kidney health. Another factor involves metabolic waste. When protein is metabolized, the body produces nitrogen waste. Two of the most well-known waste compounds are urea and creatinine. The kidneys are responsible for filtering these compounds out of the bloodstream. Now, healthy animals can handle this process very well, but protein quality and digestibility still matter. Highly digestible animal proteins tend to produce less metabolic waste. Now, poorly digestible protein sources can create more waste byproducts, and that means that the kidneys have to work harder to filter them. Now, food processing methods may also play a role. Most dry pet foods are produced through high heat extrusion. The process can create compounds called advanced glycations end products. Now, these are often called AGEs. In both human and animal research, AGEs have been associated with increased oxidative stress and inflammation in tissues. Kidney tissues can be sensitive to this because the kidneys filter out such a large volume of blood. Over a course of a lifetime, pets may be exposed to medications, environmental toxins, heavy metals, and mycotoxins from contaminated ingredients over many years. Cumulative exposures can place additional strains on the kidneys. Now, genetics can also play a role. Certain dog breeds and certain cat breeds are simply more prone to kidney disease. Inherited traits can affect kidney structure or kidney metabolism. And finally, aging itself is a factor. As animal gets older, the number of functional nephrons gradually decline. Blood flow to the kidneys can also decrease with age. That means older pets are naturally more vulnerable to kidney problems. Here's the key point. Kidney disease rarely develops overnight. It is usually a result of small stresses accumulating over time. Hydration, diet quality, environmental exposures, genetic and aging, all of these are factors that can interact. The real goal of nutrition is not to promise perfect prevention, but good nutrition can help support the body and reduce unnecessary metabolic stresses, providing adequate hydration, feeding highly digestible proteins, maintaining balanced minerals, and supporting overall metabolic health. These are practical steps that support kidney health over the long term. And when kidney disease is caught early, nutritional management can become one of the most important tools for helping pets maintain a good quality of life. So here's the key takeaway. Kidney health is not just about what happens when a pet becomes sick. It's also about daily choices that support the body year after year. Small improvements in diet and hydration can make a meaningful difference over a lifetime. Your pets deserve the best. I'm here to help. Stay informed, stay kind, and I will see you on the next one. Thank you.